Maryland is one of my favorite states to open an RAL home in. That's what I do. I own and operate care homes for seniors, and I've been training others how to do the same for the last 10 years. And I know you're not necessarily here to learn about residential assisted living, just a group home in general. So I'll break down everything I know about group homes in Maryland first, and then I'll share with you a little bit more about residential assisted living homes in Maryland to see if you're interested in diving a little bit deeper and cash flowing $10,000 a month on just one home. You see, operating a group home in Maryland requires compliance with federal, state, and local regulations. Start by researching the Maryland Department of Health and the Department of Human Services requirements, since they oversee the licensing process for many types of group homes. Depending on your target population, you may need to apply for specific licenses, such as those for residential child care programs or assisted living facilities. It's also a good idea to familiarize yourself with zoning laws in your chosen location. Some municipalities have specific restrictions regarding the establishment of group homes in residential neighborhoods. When you're starting a group home, a solid business plan is key. Your plan should include a mission statement that clearly explains your purpose and goals. You'll also need a market analysis to figure out if there's a need for group homes in that area and the specific demographic that you plan to be serving. The budget should outline your startup costs, ongoing expenses, and where your funding will come from. A staffing plan should describe the roles and qualifications needed for your team, and policies and procedures should cover everything from daily operations to safety measures to client care. Starting a group home requires a good chunk of financial investment, but there are plenty of funding sources to explore. Look into grants, especially those from state or federal programs aimed at social services, housing, or community development. Private donations can also be a great way to fund your project, so reach out to local businesses, organizations, or individuals who share your vision. Don't forget about loans, including small business loans or specialized financing for nonprofits. In Maryland, Medicaid waivers can fund services for eligible individuals with disabilities, which could cover some of the operational costs, but really none of the upfront costs. Finding the right location is going to be so important. You want a space that's affordable, accessible, and comfortable. Look for a place that's close to services like schools, medical facilities, and public transportation. And don't forget about safety and accessibility standards. Your home will need to comply with fire safety codes like ADA requirements and have enough space for the residents. The quality of care in your group home depends on the people you hire, and staffing will be key. Your staff should be compassionate, qualified, and trained to meet the specific needs of your residents. Maryland requires background checks for employees working in group homes, as well as certifications in areas like first aid, crisis intervention, and CPR. Ongoing training is also equally important, so make sure staff is familiar with your home's policies and procedures and provide regular professional development opportunities to make sure they're ready to handle challenges effectively. Our students in Baltimore, Ocean City, Annapolis, Silver Spring, and Bethesda who own RAL homes to serve seniors all started by learning a little bit about RAL first with a video just like this one right here on YouTube. So check it out and see if it's a right fit for you. Before opening your group home, you have to complete the licensing process. This includes submitting an application, undergoing inspections, and meeting all regulatory requirements. The Maryland MDH, or relevant authority, will review your facility to ensure compliance with health, safety, and operational standards. So be prepared to address any deficiencies found during the inspection process. You want to be up to code. Start by building connections with local organizations, social workers, healthcare providers, and advocacy groups. These partnerships can bring referral sources and support for both your residents and your staff. Once your group home is ready to open, make sure to spread the word about your services. Set up a professional website and open social media accounts. You want to let people know you exist. Being transparent with the community is key when it comes to building trust and attracting residents. It's also a good idea to engage with your neighbors and address any concerns that they might have about the group home. Hosting an open house or an informational session is a great way to help people better understand what you're all about and gain their support. Once your group home is up and running, it's important to be checking in on how things are going. Get feedback from the residents, the staff, and everyone involved to really spot areas where you can improve. And also stay on top of any changes in regulation and best practices so you can keep your home compliant and continue offering the best care possible. Depending on the type of group home you open, things in this video will vary. So make sure that you take the first step to decide which type, which demographic is right for you. Once you know that, let's keep the education rolling. Follow us for more.